Welcome to Healthy Bottom Line MD. I'm Dr. Dana Hayden, a colorectal surgeon in Madison, Wisconsin. Today I'm going to be talking about the basics of colorectal cancer screening, what it's about, why it's important, and all the different options we have. So what is screening? So screening is when we are performing a test to look for something that doesn't have any symptoms associated with it yet. And why is this important? Why screening is important is because we don't want to wait till someone has symptoms related to a large polyp or a tumor. And this allows us our best chance of taking care of it before it can grow into a cancer. So a polyp is a small growth from the colon wall, and this is considered precancerous. And with time, it will turn into a cancer. So doing a screening test will be sure to identify these polyps and allow us our best chance to get rid of them before they can grow into anything. So some people will say, I feel really well. I have no symptoms at all. So why would I need a screening test? Well, that's actually the purpose behind screening tests. We want to perform this test before you develop any symptoms related either to a large colon polyp or a cancer. And that allows us our best shot of getting rid of it. So when you get a colonoscopy, then we find polyps that are really small. We can get rid of them at that time. It also allows us to identify maybe a tumor that we can either take care of through a procedure during a scope or may do a surgery to remove it and then allow us to cure that cancer. So let's go through all the different options we have for screening. There are a bunch. So there's a couple non-invasive tests. And one is where you can basically at home, spread a little poop on this card, and then you send it back into the lab. And that will identify any blood in your stools. Another test, which is also performed at home, and this is actually the one you've probably seen commercials for, is when you literally are pooping in a box. So you send a sample of poop in, and that lab will test that sample for any sort of DNA, either related to a colon polyp or to a cancer. Now, what's good about these tests is that they're non-invasive. There's absolutely no discomfort related to them. They can be done at home and they're pretty easy to do. However, they are associated with some false positives, and that means you need to get a colonoscopy after. Also, they're required to be done at a more frequent interval, so you have to get them done more frequently than, say, if you underwent a colonoscopy. And finally, if they are positive, you do need to get a colonoscopy to be sure that there is nothing going on that colon that caused that test to be positive. There is a blood test that is also for screening. However, this hasn't really become very popular. You can ask your primary care doctor about it, and if it is available, they would order it and you would need to go to a lab to get your blood drawn. Now, moving on to other more invasive tests. One is called a virtual colonoscopy. A virtual colonoscopy is basically a CAT scan, and the images show basically all the contours of your colon lining and can identify polyps or tumors. Now, this seems pretty cool. It's a great technology. However, the downsides are that you still need to do a bowel prep, so you're not kind of getting away with that. And then also the radiology tech will instill some air into your colon, and this can cause a little bit of discomfort. However, this test is good as identifying polyps and tumors. But again, if it is positive or they find anything, a colonoscopy is required. Now, the last two tests I'll be talking about are a flexible sigmoidoscopy and a colonoscopy. The flex sig is basically just a short scope. It's a flexible, short, thin camera that we put in and look at the last 20 to 40 centimeters of your colon. It takes a good look at the rectum and the left colon. And what's great about this test is that it's easily done in the office. People really don't have much discomfort related to it. And it doesn't require a full bowel prep where you drink everything to clean out your whole colon. However, it does require you to do 1 or 2 enemas to clear out the residual stool that's left in your rectum and kind of sigmoid and left colon. Another positive is that if there is a polyp or something abnormal found at the time of the flex sig, we can remove it at the same time, similar to a colonoscopy. Now, the downside is we're only looking at about 1/4 to 1/3 of the whole colon, and we're not examining that entire right side. So finally, the gold standard for colorectal cancer screening is a colonoscopy. Now, this is basically done in an endoscopy suite or outpatient center. You do have to get an entire bowel prep to clear everything out. Generally, people get sedation with this, so you will need a ride home, and people take off usually that one day for work. Now, what's great about this test is that you can both identify and then also treat any polyps or other things that are found during this procedure. So the upside is huge. The downsides, there are, like I said, you do need to get a ride home. There can be a little bit of discomfort associated with it. You do need sedation. You have to take off work that day. But also at the same time, you're getting kind of your best one and done test. There are some risks that are associated with a colonoscopy. These are extremely infrequent, but the endoscopist will talk to you about them before you start the procedure. How do we decide what kind of screening test to do? Because there's so many options. So many people are nervous about any screening test just because they're scared to find out something about their health, or if they're worried about the procedure, scared about any sort of bad effects of the procedure, or they are just nervous or overwhelmed with the thought of undergoing a screening test at all. How we decide is basically what you're most comfortable with. All screening options are good. They do have some risks and benefits for each and some upsides and downsides. If you want to do a non-invasive test, those are good tests. You just have to understand that you're going to have to do them more frequently, and that if they're positive, you need a colonoscopy anyway. Those tests are good for people that are 45 years or older and have no symptoms, and then also have no family history. Now, if you just want your one and done best test, the colonoscopy is a good choice for you. Then you can get your colon cleared and make sure that there's nothing going on. If there is a polyp or anything else, we can biopsy or remove it at the time. So we're both diagnosing and treating things at one test. If you do have a polyp that's found, then you may need another colonoscopy in anywhere from 3 to 5 to 7 years, depending on the pathology, the type of the polyp, and how many were found, and also the size. If your colon was found to be clear, you had a good prep and then nothing was found, guess what? You don't need another colonoscopy for 10 years, and that's awesome. When someone is coming in and they've decided to do their colonoscopy and there is their first one, I'm always so excited for them. I congratulate them for showing up. And then I tell them I'm going to take a ton of pictures, and afterwards you'll get a report that you can hang up on your fridge proudly. So how do we decide? You have to choose what's most comfortable for you. I will say that there are some risks to each of the procedures, and there are some upsides and downsides. However, there's only one wrong decision, and that is the decision not to get screened. So be brave. You can do this. Thanks for listening. I hope this was helpful. Please share it with a friend who you think would benefit from this.